Have you ever heard of the vacuum erection device, commonly known as the penis pump? Does this device actually work? And what is the absolute correct way to use it? Today, I'm going to tell you exactly how to assemble this pump, how to use it, what the real benefits are, and the crucial precautions you need to take to ensure safety. And make sure you stay with me until the very end, because I'm going to reveal a secret about this device that very few people actually know, something that changes the way you look at this treatment entirely. So, what exactly is vacuum therapy? Basically, it is a cylindrical device designed to create negative pressure. You place the penis inside the cylinder, and it creates a vacuum environment around it. This mimics an induced erection by forcefully improving circulation and drawing blood into the area. But who is this actually for? We can recommend vacuum therapy for a wide range of men. It is indicated for patients dealing with mild, moderate, or even severe erectile dysfunction. It is also highly beneficial for patients with diabetes, and specifically for men who have undergone pelvic surgeries, such as a radical prostatectomy. That's the surgery to remove the prostate. All of these groups benefit immensely from vacuum therapy because it prevents penile atrophy. Yes, it is a reality that after these types of surgeries, or simply due to lack of use over time, the penis can experience atrophy. This leads to a decrease in size and functionality. This therapy helps improve vascularization to stop that from happening. Think of it like going to the gym. When you go to the gym and lift weights, you are working towards muscle hypertrophy. You are improving blood flow to that muscle so it grows, strengthens, and stays healthy. The penis pump works in a very similar way. It's essentially physical therapy or bodybuilding for the penis. By doing this regularly, we improve the tissue quality and ensure it doesn't shrink or lose its function. We are essentially exercising the tissue to keep it alive and responsive. Before I explain exactly how to assemble and use this device, take a second to hit the like button and subscribe if you haven't already. Also, drop a comment if you've ever tried this, or if you have questions about how it works. Now, let's get into the practical side. How do you utilize this device? There are generally two types, manual pumps and automatic pumps. I generally recommend the automatic ones because they are much easier to handle and provide a more consistent pressure. The device comes with a rubber base or a seal that you attach to the open end of the cylinder. This is crucial for comfort and function. I always indicate using a high-quality lubricant gel. You should apply this gel both on the base of the pump ring and at the base of your penis. This ensures a perfect, airtight seal, which is necessary for the vacuum to work. To use it, you place the flaccid penis into the base of the pump, pressing it against your body. Once you are in, you activate the device. If it's automatic, you simply turn it on. You want to gradually increase the pressure. You don't want to go to maximum pressure immediately. As the machine creates that negative pressure environment, it causes the corpora cavernosa, the spongy tissue inside your penis, to fill with blood. This results in an erection taking place inside the tube. You must make sure the seal against your body is tight so the vacuum can actually form and maintain that state. Now, how long should you actually use this? This is where many people go wrong and can actually hurt themselves. In consultation, there is a specific protocol I always explain, just like a workout routine. You should think of it in terms of sets, just like at the gym. We are doing sets for penile conditioning. The timing is critical. You generally should not exceed a total daily usage of 10 to 15 minutes. That is a very important safety limit. Also, it's not always necessary or recommended to use it every single day without a break. Just like your muscles need rest days after a heavy workout to recover and grow, the penile tissue needs recovery time as well. There are specific precautions we need to take to avoid injury, which I will get to in a moment. Here is a bonus tip that transforms how this device is used for intimacy. Most of these devices come with a constriction ring, also known as a penis ring, which you place at the base of the cylinder before you start. The process works like this. You put the ring on the device setup, you insert the penis, and you activate the vacuum. The pump pulls blood into the penis, creating a full erection. Once fully erect, you can slide that ring off the cylinder and down onto the base of the penis, and then detach the vacuum tube. Because the ring is holding the blood in, you maintain the erection even after the pump is removed. This allows you to facilitate an erection and actually have sexual intercourse. However, you have to be extremely careful. The ideal rule is not to ejaculate with the ring on if possible, as it can be uncomfortable or block the flow, and definitely do not keep this ring on for a long time. The maximum safe limit is 30 minutes. Do not exceed that, or you risk cutting off oxygen to the tissue for too long. So, what are the overall benefits of the vacuum pump? Beyond just improving the erection itself for the moment, we are improving the overall circulation of the penis. We are actively preventing penile atrophy, meaning we are stopping the permanent loss of penile length. It is widely used for rehabilitation after surgery and even before prostate surgery as a preventative measure. It can be used alongside oral medications like Viagra or Cialis and even alongside injectable treatments. It's a powerful co-pilot or adjuvant in treating erectile dysfunction. But what about side effects and risks? If you ignore the time limits I mentioned, you can cause hematomas, which is significant bruising. You can cause temporary darkening of the skin, or even damage the blood vessels. This is why following a protocol is essential. There are also specific groups who need to be extra careful. If you are a patient taking anticoagulants or blood thinners, you are at a much higher risk for bruising and internal bleeding. Patients with sickle cell anemia need to be careful regarding priapism, which is an erection that won't go away, and men with severe penile curvature, like a 90-degree bend, should definitely seek professional guidance before trying this, as the rigid tube might cause injury or be impossible to fit comfortably. However, while mechanical aids like this are useful, they don't fix the internal chemistry, and frankly, not everyone wants to rely on a device forever. If you are looking to restore natural, rock-hard firmness without the risks of pumps or the nasty side effects of those famous blue pills, you need to see this. There is a bizarrely simple 7-second morning ritual involving a potent purple tonic that targets the true root cause of dysfunction, something called the boner killer enzyme. It's helping thousands of men regain the thickest, strongest erections of their lives naturally. I found a presentation that explains exactly how to make this work for you. Point your phone's camera at the QR code on the screen right now to watch it, or simply click the link I've pinned in the top comment below. Seriously, check it out. It's a total game changer. Now, getting back to the pump, here is the secret that very few men actually know. Many men think this device is only a toy to be used right before sex to get it up. But the real secret is that this is a premier treatment for penile rehabilitation. Especially for men who have had pelvic surgeries or radical prostate removal, this isn't just about sex tonight, it's about saving your function for the future. By using the pump regularly as a therapy, even without the intention of having sex, we improve oxygenation of the penile tissues. We prevent the fibrosis, scarring, that causes shrinkage, and we can actually help restore the body's ability to have natural erections over the long term. It essentially retrains the penis to function. Vacuum therapy is an excellent alternative for anyone looking to improve their sexual health, serving as both a treatment for erectile dysfunction and a vital tool for long-term rehabilitation. Remember, consistently following the correct protocol is key to getting results without injury. If you found this content helpful, make sure your notifications are on so you don't miss the next video. I'm leaving a suggestion here on the screen for a video comparing Viagra and Cialis that you definitely want to watch next.